In this video, we'll learn about apex beat. We all know apex is formed by the left ventricle. So whenever the ventricle goes for contraction, the apex of the heart comes and touches the chest wall, and that is felt like an impulse. Okay. So now, when you keep the whole palm on the precordium to examine the apical impulse, we should consider the lowermost and the outermost cardiac impulse as apex beat. Sometimes many impulses may be felt throughout the precordium, but we should consider whichever is the lowest, right, and the outermost cardiac impulse, and that is considered as an apex beat. And now just observe, it is present in the fifth intercostal space. If I draw an imaginary midclavicular line, it is medial to midclavicular line. So you can see the theory aspect here. According to definition, apex beat is the lowermost and the outermost cardiac impulse which is felt on the precordium due to left ventricular contraction. So where exactly do you find the normal apex beat? It is in the left fifth intercostal space, half an inch medial to midclavicular line. And what is the size of this apex beat? Normally, it is roughly a coin-sized impulse, like 1 rupee coin. The diameter of your apical impulse is almost equivalent to the diameter of a 1 rupee coin, which is almost to about 2 to 2.5 centimeter in diameter, and it should not occupy more than one intercostal space, meaning the normal apex beat will be limited to only one intercostal space. Maybe it is on the fifth one, or sometime it may be shifted to fourth, or it may be shifted to sixth, depending on the clinical condition, but it should not occupy more than one intercostal space normally. So now coming on the duration of apex beat, it should not it usually lasts for less than 1/3 of a systole, meaning, now just observe here, this is a cardiac cycle which I've drawn here. The cardiac cycle is divided into ventricular systole and ventricular diastole. Ventricular systole lasts for about 0.3 seconds, and ventricular diastole will last for about 0.5 seconds. So in total, it is about 0.8 seconds, right? So the duration of a cardiac ventricular systole is 0.3 seconds. Up till here is your ventricular systole, right? 0.1, 0.2, 0.3. Now your apex beat, it should last only up to 1/3 of the ventricular systole. It means it lasts only for about 0.1 seconds, okay? But in abnormal conditions, it is sustained, meaning apex beat is sustained, meaning throughout the systole we'll feel the apex beat. That is the meaning of sustained apex beat, okay? And usually we get what is called a tapping variety. That is the character or the type of apex beat normally found as tapping type of apex beat. But in case of hyperdynamic circulation, like whenever the patient has fever, or in case of anemia or hyperthyroid patients, the amplitude or force of apical impulses increased.